So the FIGHT-202 study was, I would say, a pivotal study to evaluate the efficacy of pemigatinib in patients with FGFR2 fusions. It included patients with these fusions, but also patients with other FGFR2 alterations, and as a control group, patients without alterations in the FGFR2 pathway. So basically 3 arms. They were not aimed to be compared with each other, more that the efficacy of pemigatinib was evaluated in these 3 cohorts. The largest cohort were patients with FGFR2 fusions and rearrangements, more than 100 patients that were included, and patients were treated with pemigatinib in a 2 weeks on, 1 week off cycle. Primary endpoint was the overall response rate, and we presented the data here at ESMO GI in Barcelona this year. The response rate was 37%, which is really remarkable if you remember that with chemotherapy, response in second-line chemotherapy, in second-line in cholangiocarcinoma is single digit, and therefore I think it really highlights the efficacy of this drug in this patient population. The duration of response was a little bit more than 9 months, which I think is also very reasonable, and accordingly PFS was 7 months, and overall survival now final 17.5 months. So outcome data were not surprisingly not as good in Cohort B and C, and specifically in Cohort C, patients without FGFR alterations. PFS and overall survival was really short, as we would expect it in this patient population. Overall survival of only 4 months. So, I mean, highlighting that this is really a devastating disease. For patients with FGFR2 mutations, I think the jury is still not out. I think it's a little bit more complicated compared to the fusions. We have seen some disease stabilization, and PFS was however, was only 2.1 months. I think this is something that needs to be evaluated in the future. So if you take everything together, the data confirmed the efficacy of pemigatinib in patients with FGFR2 fusions and rearrangements. As you know, the drug has been approved by FDA and EMA, and I think this approval is clearly not really confirmed, but I think the final data now support this approval, and we have here clearly a clinically meaningful option for our patients. And based on the data we have seen also in other single-arm phase 2 studies with other drugs, and the picture here is really very consistent. These FGFR inhibitors are now evaluated in the first-line setting compared to our standard of care, gemcitabine and cisplatin, and I'm really looking forward to these patient recruitment. It's challenging. So whenever you have a patient who has not yet started gemcitabine cisplatin, and if there's an opportunity to include these patients into one of the studies, please do so. I think we really need these data.